All right, well, thank you, Troy and the panel and everybody today. Really, you've been very generous with your time and your expertise, and I hope that this is just the beginning of this engagement. I have the unenviable task of trying to summarize the collective brain power. And as I was thinking about the comments, I was wishing, like, wouldn't it be cool if there was a technology tool that could somehow listen to us and then make sense of it and summarize it and present it back to us. So, no, it's crazy dream. Maybe one day that'll be here. We'll talk about the tech stack for the National Academy for the next meeting. But that said, let me do a very crappy imitation of ChatGPT and talk a little bit about what I've heard, which we will be moving forward. So the things that I just wanted to sort of try and summarize is, what are the problems we're trying to solve? What are some of the near and then further term applications of AI, to think about Victor's charge to us? And then how do we think about the responsible use and effective oversight of this? And then obviously, what are the next steps? How do we collectively move as this very intentional multi-stakeholder collaborative that I think is representative of all the players that are going to be needed to extract maximum value out of this technology opportunity? So I heard 4 problems kind of bubbling up in our conversation. One is, we have more information available to us today than we can handle, than any human can handle. 2 is, we have more people that we need to treat that need our help, and fewer clinicians to meet them for that treatment. 3 is, we have fewer monetary resources in which to provide all the tools needed to treat those patients and support those clinicians. And 4th is, our care is more uneven and more unequal than is acceptable, morally acceptable. So if those are our problems, then how do we think about generative AI's applications and what we can do near term as opposed to further out? And the way that it sort of shaped up to me as I was listening to people's perspectives and thinking about this is that I think that output of generative AI that allows us to be more efficient with our pre-existing information and some of our care processes in somewhat lower risk applications is probably what we need to do next. And a lot of you have heard and seen evidence of this. I would argue it is largely in the clinical documentation space. We're seeing this with note generation, chart summarization, and literature information retrieval. I also think there's probably a lot of opportunity in some of our back office operations that really are the bane of our clinicians' experience today, and that would be things like prior authorization, clerical documentation, and frankly, some of the regulatory documentation that we're compelled to provide, but takes up a ton of limited time to our clinicians. I also think there are some efforts in the research side around discovery efforts, protein folding, genetic associations, and even clinical trial recruitment that's probably close to ready for prime time, and we should think seriously about getting that into the real world. And then finally, on the public health sphere, I think there is opportunities to have it help us think about trends in the public health and the populations that we see, recognizing this is probably one of the worst data areas in our society. And so how do we make sure we have the right data fuel for that? So then when I think about later term and what's going to need further development and frankly probably more oversight, it's the output that actually provides advice and decisions and recommendations for action. That's where we need to be really certain we're doing right by our patients on this. So we talk about using generative AI as a clinical colleague, and whether or not that fits with this paradigm that I really love of the human in charge and the AI in the loop, we can figure out. But I think to use it for diagnosis and management needs further development. And then the thing that I think is truly unique about this technology is it allows us to think about its help in language-based therapeutics. The most immediate example I have, and I was talking to one of the colleagues here, is mental health and talk therapy. But even the way that I counsel a patient to stop smoking or take a med or manage their diabetes, what I say, how I anchor it, how I describe it, fundamentally is part of the treatment plan. It really does affect what that patient does, doesn't do, thinks about, has self-efficacy for their health. And in many ways, because this generates language, it now becomes possible for the tool to help or if we do it irresponsibly, replace what we're doing. And I think we need to think very deeply about how do we think about it, how do we evaluate it, and how do we deploy it responsibly. I think other things are, and I appreciate Grace's advocacy for patient and caregivers, if the tool's going to be giving them advice, actions they're going to take, that's an added layer of responsibility. And then two other thoughts for me are clinician training. As we start to introduce this into medical education, how do we make sure we supplement the mental models we need to convey to our clinicians rather than replace them? And then finally, in the public health sphere, if we're going to recommend interventions, recommend vaccine campaigns, other things where their action will be taken, there needs to be a lot of responsibility. So I think this is the beginning list that I heard you guys tell me, and that I think is a really exciting sort of near and further term agenda for how generative AI can work. So then as we moved into the afternoon, responsible use and oversight of generative AI. And to me, a lot of people talked about the AI development lifecycle, the software development lifecycle. And to me, that's a really nice framing of what needs to happen at those steps and who amongst us in our sectors need to make sure we're contributing effectively to that. So when we're training the data, do we have the right availability, privacy, and interoperability of the data? Well, who's involved in that? And you've heard some of that from the government, from healthcare providers, and from data holders, our EHR partners, and other people who are becoming the curators and librarians of health data. As we then make sure that our models have sufficient transparency in their development, in the inputs they're taking in, and importantly, the outputs, it's those developers. And it's not only our technology partners, but it's also the healthcare systems that will be shaping and fitting those models to best fit their populations. We need trustworthiness of results. Those are evidence standards. That's on us as the academy. It's on us as research funders. It's on us as developers. And I think thinking about how we effectively fund and support evidence generation is really important. The effective deployment and clinical workflow and training in its use is on us as health systems. Peter, myself, others in health system leadership have to help lead the charge on that in conjunction with our tech partners. And then we need to move into post-deployment monitoring. We need to monitor for drift, which is on us as health systems, as well as tech developers. We need to monitor its use at that socio-technical intersection of how our patients, how our care teams, and how all users of these tools are appropriately or inappropriately or unexpectedly using this. And do we have mechanisms to understand that and assess what bucket it might be in? And then finally, because AI is ultimately a reflection of us and all of our biases and limitations, how can we help AI, but at the same time us, do a better job of being equitable and fair in the care we provide? So with that summarization of your amazing insights, I would say, how do we move forward effectively? And I think we need to make sure we realize we're not talking today about what we need to do to deploy generative AI in healthcare. We are talking about what to do since generative AI is already being used in healthcare today. Patients and doctors, including this doctor, use ChatGPT, and we use it in decisions. But are we using it correctly? And I think that's the agenda in front of us. And I would say actually its current use is a good thing because it allows us to empirically learn what works and what doesn't. AI is a complex system, and for those of you who understand the definition of a complex system, what you know is you can't predict how a complex system will work. It's literally impossible to predict. So a conceptual framework suggests that the best way to operate in this system is you probe, then sense, and then respond. Let me say that in language that maybe our researchers and quality improvement folks can say. You test, you measure, you learn. Let me say it in a way that maybe our technology partners understand. You conduct rapid, iterative, agile sprints. Let me say it in a way that the academy might say it. You construct a learning healthcare system. And I think this is a real opportunity for us to take the opportunity this technology provides, appreciate what's going on, learn from the experience, bring to bear the existing expertise, and a lot of the regulatory frameworks that frankly will help with generative AI, bring those to bear, and then iterate our way to effective, responsible, and ultimately equitable use of generative AI in healthcare. So what are we going to do as next steps? We need your ongoing input. As I've said a couple of times, there'll be a survey distributed. Please fill it out. We have free text aspects to it. I would love for you to sit on it for a few days, maybe have ChatGPT help you, and then put together any additional things you heard or insights you had. We need to collect all of that. We'll also be engaging with other stakeholders in future meetings using the amazing convening power of the Academy and building that in, and then ultimately developing this into an action plan and principles like Victor was charging us with to advise our ecosystem on how to move forward, and then to be the igniter of the actions. The Academy convenes the ideas, collects them, and then our job is to sort of ignite that to the actors. And the actors are what you all represent in this room. And so I would just encourage you to ignite yourselves and your partners to move this exciting opportunity forward. So with that, I'll stop. I really appreciate your engagement, and I'll turn it over to Michael.
Well, that was really a wonderful summary, Tom, and it makes it really easy for me to move into my couple of very short follow-on comments. And the first is to start where I began in the morning, and that's with thanks. Thanks to you, to the committee, and to everyone in this room who's brought incredible insight to the day's discussion. But from the perspective of the National Academy of Medicine, as Tom implied, actually he was pretty explicit. We're not through asking. We're going to follow up with you and ask very specifically for your reactions on 3 dimensions. Your dimensions about actions, your suggestions about actions, your suggestions about criteria, and your suggestions about messages. And to be a little more specific in that respect, on the actions front, we're going to ask you for your key take-homes on the most important collaborative action steps to move progress, including what you might like the NAM to do. We can do a little of this, but we have heard already about wonderful activities that are underway in a collaborative sense around the nation. And so what is, from your perspective, the most important collaborative action that needs to follow on? And there'll be a lot of different perspectives. Criteria, the question that was posed earlier, again, in each of these, picking up on Victor's charge to be practical, was the interest in your criteria that you would use for developing a taxonomy of the applications. What applications can be deployed now, and under what circumstances, what applications are on the cusp, and what's needed to move forward, and what other potential applications are at hand, near or far, and what's needed to move each forward. And then the third piece on the messages, apart from short, what characteristics would best describe the NAM summary of issues and framing and priorities that we could share widely as growing out of this meeting? Again, we'll follow up with a formal request on that front, and that formal request will also start with thanks. I want to, in that vein, give special thanks once again to our funders of today's meeting. Daniel Yang and Tommy Wang from Moore are here. Cindy Alvarez from Doris Duke has been online. And so thank you to them. And special thanks, of course, to Sunitha, Annie, Laura, Stephanie, as well as Julie, Asia, and Amanda, the staff who have made this happen. And as we prepare to head home by planes, trains, and automobiles, of course, refining your thoughts, thinking already about the follow-on. Let's give a round of applause for those who so skillfully made this meeting possible. Thank you all. Safe travels and to be continued.